Unit 1. Taking a History 1. Task 1.
Good morning, Mr. Hall. What's brought you along today?
Well, you see, Doctor, I've been having these headaches, you see, and...
Uh-huh. And how long have they been bothering you?
Well, they started about... Well, it must have been about 3 months ago.
I see. And which part of your head is affected?
Well, it's right across the front here.
And can you describe the pain?
It's a sort of dull and throbbing kind of pain.
I see. And do they come on at any particular time?
They seem to be. They're usually worse in the morning. I notice them when I wake up.
And is there anything that makes them better?
Well, if I lie down for a while, they seem to go away.
Yes. And has there been anything else apart from these headaches?
Well, my wife, she says that I seem to be getting a bit deaf.
Well, Mr. Hall, I think at this stage I'll start by checking your ears to see if there's any wax in them.
Unit 1. Task 8.
Come in, Mr. Green. Come and sit down here. I've had a letter from your doctor, and she tells me that you've been having pain in your chest.
Yes, and in my arm, and also tingling in my fingers. And
yes. Now, when did you first notice this pain?
Well, I suppose about 6 months ago.
And can you remember when it first came on?
Yes, well, I remember I got a bad pain in my chest when I was shopping. It was so bad I couldn't breathe. And...
where? In which part of your chest did you feel the pain?
Well, right across my chest.
And how long did it last?
About 10 minutes.
And what did you do when it happened?
Well, I just stop and wait for it to go away.
So, have you had the pain again since then?
Yes, I often get it when I overdo things and,
I think at this stage I'd like to examine your chest. So, if you could strip to your waist.
Right. There we are.
That's fine. Fine, I'll just check your pulse first of all. Fine. That's fine. It's quite normal. 70 per minute.
Right.
Now your blood pressure. Fine. That's quite normal too. 130/80.
Oh, I'm pleased to hear it.
Now, I'm going to listen to your heart. So I want you to breathe normally. Your heart sounds quite normal.
Well, that's a relief.
Well, now I want you to take deep breaths in and out while I check your lungs. In, out, in, out. Fine, they're completely clear. Well, Mr. Green, the pain you've been having sounds very much like the pain of what we call angina. And this occurs when not enough oxygen is getting to the heart. Now, I'd like to check a few tests, and following that, I'll be able to advise some treatment for you.
Unit 1. Task 12.
Good morning, Mr. Hudson. I see from your card that you've just moved into the area. And perhaps you could tell me a little about your previous health, as I won't get your records for another month or two, and then we can deal with your present problem.
Well, I've always been very fit up till now, but...
Have you ever been in hospital?
Oh, only when I was a child. I had an appendicitis when I was 8.
And what's your job? What do you do?
Well, I work for the post office. I'm a postmaster.
And I see that you're what, 58 now. And have you...
Yes.
Have you always been with the post office?
Yes. Well, apart from my time in the army, you know.
I see. And you're married? Any family?
Yes, 2 girls and a boy.
Fine. That's fine. Now, can you tell me what seems to be the problem today?
Well, it's this terrible pain. I've got this terrible pain in my back. I've had it for more than a week now, and it's...
I see. And can you show me exactly where it is?
It's down here. Here.
And does it go anywhere else?
Yes, it goes down my left leg, and I feel pins and needles in my foot.
I see. And is it there all the time?
Yes, it is. It's keeping me awake. Awake at night, and I can't get out into the garden. I've been taking aspirins, but the pain, it just comes back again.
And was there anything that started it off?
Well, yes, I've been trying to sort out the garden at my new house, and I don't know, I may have been overdoing things a bit.